rights, one nation, under God, indivisible, with liberty and justice for all.
We're going to start tonight with our, got a squeal. Is that what? Thank you. Thank you for fixing that. We're going to start tonight with our special recognition, and we're going to have our Economic Development Director to come up and do that.
Good evening, everyone. Does that sound all right?
Good.
It is my distinct pleasure to recognize Keith Smith for his 13 years of exemplary service to the Franklin County Economic Development Commission. Keith was first appointed to the EDC in 2013 and became its chairman in 2023. Throughout his tenure, he has demonstrated an unwavering dedication to Franklin County, our business community, and expanding opportunities to our residents. Over the years, Keith has provided steady leadership and vision, helping shape our community and our economy and leaving a lasting positive impact on our community. Franklin County is stronger today because of his commitment, service, and leadership. Keith, will you come up? So on behalf of Franklin County, it is my honor and privilege to present this plaque in appreciation of your outstanding service and the many contributions you have made to Franklin County.
Thank you very much.
Thank you.
I really appreciate it. Fortunate enough that this is my second recognition this year. And so it feels like I'm kind of coming to the end of my life, and I'm wondering if you guys know something that I don't. But hopefully not. It's been an honor and a blessing to have worked. And I look forward to future projects and hope that I can be involved with those as well. I love where we live. I love the things that we're accomplished, and we've got still quite a bit to do. Thank you very much for this recognition. I've got my pen ready.
We are going to get a picture of all this, but I just want to say, as chairman here, that I've known Keith and worked on a lot of different committees when I worked for the county for all those years, and he stands right up, and he deserves this award. So congratulations, Keith. Let's go out and do a picture. We're going to be out front. Your whole family. Okay, now it's time to go to item 1, which is our comments from the public. Our first comment is from Kimberly Galusha. Galusha, I never get that right. Thank you.
Kimberly Galusha, 1134 MC Wilder Road. I would like to ask permission to hand out some helpful material. I'll start with. For the past several months, I've stood before this board and spoken about groundwater, private wells, transparency, and the impact of airport operations on nearby residents. I continue to raise these concerns because the people most affected are still not getting answers. The figures before you show repetitive touch and go flight activity concentrated over several residential neighborhoods. These are not occasional arrival departures. These are repetitive training operations conducted over the same homes and families. This community is being asked to carry the burden of airport growth and economic development for the benefit of Franklin County. But the residents living below these flight paths are the ones experiencing the noise, the disruptions, and the concerns associated with repetitive aircraft-led admissions. These residents are the ones directly exposed to impacts while others receive the benefits. We are not asking to eliminate the airport. We're asking why the same neighborhoods must continue to absorb the impacts when alternatives should be required. Flight training should be conducted over vacant land, industrial areas, and county-owned property, rather than repeatedly over residential homes and neighborhoods. For months, we have contacted you, all of you sitting in front of me, as well as the airport director, Bo Carson, with documented concerns, questions regarding risk of groundwater contamination, noise abatement, and training operations. And we have asked for communication, we have asked for consideration, and we have asked for answers, and we have received none. Instead, the most significant response we have received was an estimate of approximately $6,800 to obtain public records related to this airport. After asking how the estimated was calculated, I received no follow-up. Think about what that means. The residents who are most impacted by these decisions, the people whose homes, drinking water, health, and the quality of life are affected, are being told that they must pay thousands of dollars to access the information about what is happening in their own community. This is exactly why so many residents have lost faith in local government. They raise concerns, they ask questions, and they're ignored. You have the authority to change that. You have the ability to show residents that their health, their safety, and quality of life matter just as much as economic development. Tonight, I'm asking the board to stop ignoring concerns of communities carrying the greatest burden, to demand transparency, and to ensure that residents are not sacrificed for the sake of growth. Thank you.
Thank you. Our next speaker is Scott Strickland.
Imagine in your mind going to get ready to go to a county meeting and pull up to a stoplight and watching a car run off the road and you jump into action to save a lady's life. You know, that's what we teach at Bond-Sur, and I had the pleasure of doing that last Tuesday. The lady is still living, driving checking today, and without the help, she would have been gone because nobody recognized her besides the road. If you had jumped in here and got her to the hospital, and she's doing better, but she ain't excellent, but she's doing better. And so, you know, that's what we teach at the CERT group level, to how to help your neighbor at a moment's notice. Her car was still in drive. So I jumped in the passenger side, you know, I ain't always got to sit in the chair, I can move around. A lot of people talk about me not being able to do stuff in this chair. It upsets me that I ain't 100% like I used to be, but I still do stuff. And I'm glad the Lord led me to help this lady. And I just wanted to share that with you, that we're doing the right thing at the right time when we need it. The other thing I want to talk to y'all about tonight is we're running a school drive as well as Frank County events. We got 2 boxes at the door at the Walmart. Y'all can help us, each one of the commissioners go by there and put in a bag. All you got to do is buy it, put it over in the box, we'll take care of it. We'll get it to the place that needs to go with social services to get these kids to school supplies. We're trying to help them out. And so I'm just asking y'all if y'all will please help us get this accomplished, because we need help. Over the weekend, it's been great, but not where we want it to be, but people are picking it up. Bun Search is also expanded out. We'll be doing the Red Cross over the weekend to finish up some training. We already are expanding out to house fires in Franklin County. A couple of our people already have wrote up some stuff for the Red Cross to get people money for their loss of their homes. We'll have a field trip Saturday up there to finish up the rest of the disaster part of it that helps Franklin County, because we have nobody close by to do it. So we're stepping in to help them to help us. And so we're really proud of that. And we're also working on another program to bring to Franklin County to help when disaster happens. We ain't quite got it where it needs to be, but I'll talk about that when that gets in there. But we're happy to be where we're at and doing what we're doing. We're doing an excellent job, and it is showing across the county. And I appreciate everything that y'all do. Thank y'all for letting us do what we do. Tomorrow night, if we're getting out, come on by and see me and Mark over at the Lewisburg Fire Park for the National Night Out. We'll be giving away hot dogs, hamburgers, and I think, Tim, you coming tomorrow? And Tim got to be there with us. And so come on by and fellowship and see the kids and watch them give away some supplies over there. But thank y'all for letting us do what we do.
That completes all of our comments from the public. We'll move on to item number 2, the consent agenda. And do we hear a motion, or do we have any questions about the consent agenda?
Chairwoman, I think I'd like, on the consent agenda, item D, I'd like to pull that out for a little further discussion. I'd actually like the county attorney to give a little bit of an explanation on the details of that. Gina, if you don't mind. Good.
So this agenda item is related to a water tower that is located on next to the Paulsive plant that's on 56. This is who owns the small parcel that this water tower sits on has been a matter of controversy for a very long time, probably around 15 years. The county is sure that they are not the owners of that parcel, but the corporation has been under the belief that the county has, based on a map that was filed with the Register of Deeds, but there's no deed associated with that. So what you would be voting on is to approve an agreement that clears up the ownership issue. Paulsive has agreed to take responsibility for that parcel and the water tower that sits on that parcel. And then in exchange for them taking that ownership, made really clear that they have that ownership. The county is contributing $140,000 for the repair because it was in disrepair. It has never been connected to any utilities owned by Franklin County. It was connected to utilities owned by the town of Lewisburg. So there really isn't a whole lot of evidence to say that county owns it. We're asking the chairman to sign a deed, which may look like that we're giving away property, but I wanted to be really clear that we're not giving away property. The county doesn't own it. A quitclaim deed is a deed that simply says any ownership that you think we own is yours. Any questions about that?
Okay. One, about that, was there gonna be any future repairs that are gonna be upon us?
No, this is exactly what we are
You're
trying
making
to
sure.
clear up. Thank you, Mr. Foy, for asking that question. This will be the third time that the county, because of this ownership question, has been in the position of making repairs. This will be the last set of repairs that the county will make, unless,
One other thing, that water tower just serves them only.
yes, sir.
It's not in the system, so to speak, with the county or city or,
That's correct.
okay.
Another very good question. It is
It's all-
only serving their fire suppression system.
Okay.
So basically what we're doing is we're going to turn over official ownership, even though it was never ours. They are going to own this water tower. So therefore, any future repairs is going to be on them. The county is going to be out of this completely, so we never have to bring in front of the taxpayer having to fix this water tower or update this water tower ever again.
That is correct.
Okay.
We're just putting it in writing.
I just want to make sure everybody knows that.
So
Thank you,
leave that
Gina.
on here? Leave that-
Absolutely.
Okay,
I just wanted clarification so that if the public looked at it, everyone understood.
okay. Is there any other questions about anything else on the consent agenda from anybody? If not, do we have a motion to approve the consent agenda tonight?
Motion made. Second.
And we have a motion and a second on the floor. Everyone say aye if you approve.
Aye.
Anyone that disapproves, say no. Okay, motion carries. Okay, item number 3 is an action item. A is via update, and I'm gonna call up Elliot Clark. There you are. I couldn't see you back there. I thought, where is he? Okay.
Give me a time. As you do a quick handout.
Thank you.
All right. Road, make Justin proud here. There we go. Good evening, Commissioners. Thank you for this opportunity to speak before you tonight. I am Elliot Clark. I am the Regional Director with Via Health. Via Health serves 32 counties in the state of North Carolina. We are your public managed care organization that covers Medicaid, state funding for behavioral health care, specializing in mental illness, substance use disorders, and intellectual developmental disabilities. So we are one of 3 now managed care organizations in the state, and proud to be here and proud to serve Franklin County. My specific area of focus is in a 5-county region that includes Franklin, Granville, Vance, Person, and Alamance County. So before you tonight, and I must apologize, usually, I think as you guys know, I'll send you the information ahead of time, but we were running a little bit close, and we've got a big update that's a little fluid for us, so we needed to go through the channels, and we're unable to get it to you in advance, but you have a printout in front of you, and would love it if you have questions at the end. But tonight, we'll talk a little bit about our big news, our merger that we're about to go through. And I promise not to focus too much about the organizational updates, but to drill down on just what's going on in Franklin County, what kind of things we've got going on, and who we're serving. So, thank you. Just a quick summary on the 3 major accounts that we have with the contract with Department of Health and Human Services to administer for this population. So as a tailored plan, we receive Medicaid dollars to serve folks with mental health, developmental disabilities, substance use disorders, and traumatic brain injuries. We also receive funds from the state in a single stream allocation, which we got the budget passed, and luckily, I tell you, throughout my career, we've experienced cuts in our state single stream budget. But for this year, The state's keeping us whole, so we're able to operate at a continued expense that we've had from the previous biannual budget. So that we're thankful for that. We use those funds to cover services for folks that don't have insurance. And that means not just if they don't have any insurance, but if they're underinsured. If what their needs are don't meet the health plan that they have, the state gives us some supplements so that we can fund providers, albeit a very limited pot of money, but to make sure that we can cover folks that are underinsured and uninsured. Those funds actually also support our crisis system. So services you may hear about, mobile crisis, those types of things, and a facility that we'll talk about that you guys have heard in the past, but got some updates on. Those state dollars really fund our crisis continuum of care. And then we have our North Carolina Medicaid Direct for folks that aren't enrolled in a tailored plan, but just need direct billing for mostly physical health services. So we provide services, not just behavioral health care, but if they're a member of ours and if they fall in our special population, we pay for the whole person's health care. All right, so here's the big news. So I mentioned that we are part of a network of LME MCOs, and I think I mentioned 3. We're about to be 3 LME MCOs in the state. We're 4 right now. Partners Health Management and Via Health will be merging. We will be the surviving and managing entity, but it's very much a partnership. We're coming in this with a lens of parity to make sure that their particular region stays strong and that resources that they've had in place don't change one bit and hopefully improve. So Via Health and Partners Health Management will be merging October 1st. Partners Health Management currently manages 15 counties, mostly in the central to western Piedmont, up to as far east as about Forsyth County. And then we pick up in Alamance County and head north and east from there. And then the rest of Via's territory is to the west. We'll show you a map here in a moment to give you a visual. So we will become Via Partners October 1st and manage these services in 47 counties in North Carolina. So the primary reason behind this is not just a business decision, not just an organizational move, but it's very much a strategic move in the trend of Medicaid reform and expansion and privatization and commercialization that we've seen over the last 5-6 years. We want to make sure that our public system is maintained. We are a special health plan, very much a niche health plan that's accountable in a very different way than your commercial insurance plans are. Right now, you have tailored plans, which is us, and you have standard plans, which are commercial insurance, Blue Cross, Centene products like Carolina Complete, United, and they do great things, but they cover the lower cost side of behavioral health care. Our niche is the more significant need and the higher cost of behavioral health care. So we really feel like that's a very sensitive population and a need for public accountability. So we want to preserve that. We feel that merging these 2 entities together will make sure that the public system stays strong, that resources are more efficiently utilized, that limited state funding that I mentioned. We have a lower administrative cost, so more of those services can wind up with families that need it. This decision was very much supported, not just by our board and by the 2 organizations, but by the Secretary of Health and Human Services. This is a brief quote. I won't read, well, it's a long quote. I certainly won't read that. But what it sums up is the recognition that right now there are still, in the state's eyes, too many managed care health plans managing Medicaid. And as I said, a major benefit is administrative cost and the provision being more efficient if you can reduce that. So I brought you through and described kind of a visual for the state. This is the map that shows what those 3 territories will look like. To the left in the dark blue, you have Via Partners. Again, this will be October 1st, effective October 1st. And in the middle, and you'll recognize this, but in the most urban of counties in the state, you have Alliance Health. And then to the east, our friends that manage services throughout the coastal plains and all the counties that come up through the Piedmont up to Guilford is our friends over at Trillium Health Resources. We all 3 operate our plans very similarly, but are individual entities. So the approach to this merger, like I said, this is not a takeover. This is not, partners necessarily coming underneath VIA. This is very much a partnership of the two organizations to make sure that there's parity and make sure that we can be competitive in a competitive market. So again, our brand name will be, our legal name VIA Partners Health. Our brand name will be VIA Partners. So what does this mean for us? What does this mean for us in Franklin County? We are keeping the same design. We're keeping the same presence, same care management structure, same community relations structure, training and development. All of our forward-facing, community-based staff and programs will not change. So I'm certainly encouraged by it. But I think counties, obviously, with any kind of big move like this, are wondering what's the footprint going to look like? What types of things will happen and we'll see change. I think the ultimate thing that we were going to drive home here is that there won't be a negative change, but I think we'll see a positive change because hopefully providers will be even more stabilized because of the funding channeling directly. So some of the trainings that we do for our partners like CIT, same faces, you will continue to see. So our governing board. The new board will include 13 representatives from each catchment area. 13 from partners, 13 from VIA. I mentioned that parity. We feel like that's important. The reason why we're talking about this tonight is a little bit of a heads up. And I do want to take a moment and appreciate our commissioners that have served on our regional boards. Commissioner Speed is our active member on your board that serves VIA. Also want to appreciate you, Commissioner Bragg, for your years prior to serving with us. And also Meredith Webster, my friend from the Franklin County Sheriff's Department, is an active regional board member. So this just reflects on the fact that we've got people that are rooted here in this county, that work in this county, that understand what the needs are, that advise us. That will carry through, and members that are, some legacy board members will remain on our governing board, but for the County Commissioner Advisory Board, we'll have one county commissioner that would be assigned. You're about to get a letter from us that outlines just all the steps that are needed. It's not overly complex, but essentially what it means is that you would recommend and appoint a commissioner to continue on our County Commissioner Advisory Board. Right now, that's Commissioner Speed, and we appreciate that. And you notice here a little bit of a timeline. The first formal board meeting will be in October, of course. This outlines a little bit more about what the County Commissioner Advisory Board means, but essentially this is how we meet our requirement with the state and in our contract. They dictate how we're governed. We need to make sure that every single county that we represent is represented on our advisory and our governance structure. So be on the lookout for that letter coming through. And here's some future dates, some just key dates that will be coming as part of this merger. I promised you I wouldn't spend all my time on this. All right. Here we have some service provision data. In Franklin County, we cover about 1,500 people. That's our specialized population in Franklin County. In this schematic in front of you, and those 1,500 people are people through the tailored plan. So our numbers, when we use those state dollars, fluctuates from time to time. That's why you'll see this climb a little bit. We always serve a little bit more than what we have enrolled. Our total distinct count of folks served this fiscal year to date, so actually previous fiscal year to date, July 1st of 25 through April actually is what we have on this because it's claims based and there's a lag, but I wanted to make sure that you saw exactly where services were provided. So this gives you a snapshot. So within that time frame for the most recent fiscal year, we're looking at about 1,800 folks served in Franklin County. And you'll see the breakdown there on the left. The vast majority of individuals that we cover and receive services are adults, and mental health is the primary diagnostic category that receive those services. And you see the breakdown there. We've included child and adolescent and transitional youth because we feel like that's important. We'll have a little update that will reflect why they're about a new service that's coming to Franklin County that we're excited about. And we also want to make sure we reflect services for our seniors, 65 and up. Those numbers on the 65 and up are always lower, but adults 25 to 64, you'll always see as the highest. And then on the right, you have a payer breakdown. the vast majority being Medicaid. 1,248 folks receive the service through the tailored plan, Medicaid. And we wouldn't be doing anything if it wasn't for our providers. I know I stand up here and talk like we do a lot. We do a lot, but our providers do the hard work. They're the ones that are out there that are doing business in the county. They're paying rent in the county. They're employing people in the county, clinicians that are reaching this population. So our contracted providers are everything to us. I wanted to give you guys a snapshot. I know the folks in the crowd can't read these names, so I'll mention just a few of them. But they're important providers in the county. Vision Behavioral Health Services is one of them. That's our comprehensive community clinic. They get the lion's share of state funds for us because they cover some of those crisis walk-in services, some of our services within the jail, folks that aren't well insured. They do a majority of that. Obviously, Duke LifePoint, Mariah Parham Hospital, close partner and a contracted provider of ours. At-home counseling in Lewisburg. We also have youth villages that provide some services for juvenile justice and innovative behavioral health services in Youngsville. So we've got a variety of providers that are reaching our folks in Franklin County. So here's some of the projects we've got going on. The big one that I'm really proud of, because this is about to lift off the ground very soon, is a day treatment facility. I don't know who of y'all have heard about this. Maybe if you have, good. So Vine Academy is right there in Franklinton. I know Commissioner Bragg, that's right there in your town, and you probably rode by there. There's been a lot of work going on over there. Commissioner Speed and I have talked about this, but over there, 101 Vine Street will be our day treatment facility. And really what this is for kiddos that aren't successful in school because of either what's going on in the home or diagnostically with them. They're either homebound or they're in an alternative setting, but they really need surrounded behavioral health services while they're in school trying to get through their day. This provides that environment. So it combines that intensive therapeutic service with instruction and programming on the academic side. It'll serve kindergarten through 5th. But we've had a lot of discussion with the school system and keeping our eyes very close on the potential to expand that to middle and high school once we see this lift up and be successful.
In that middle school. That's
Yes,
right,
ma'am.
on the
Yeah.
middle school property.
Bringing it back to life. That's right.
Yeah.
Elliot, how many kids do you think you'll be able to serve? I'm gonna ask this on a day. I'm gonna ask this on a daily, but maybe a weekly or a monthly. What kind of numbers are you guys expecting?
This is a terrible answer, but it does depend.
Yeah.
There's some ratios, teacher and clinician to student ratios.
Sure.
The clinicians don't like there to be more than 15 to 1 in a classroom
Right.
setting.
Yeah.
So it really
Yeah.
depends on enrollment, but and the number of teachers that will be assigned to each grade,
Yeah.
right?
Yeah.
But a lot of these programs can serve, between 80 to 100
Okay.
kids. So
Great.
we're excited to see that come to fruition. We don't anticipate it first. I haven't seen numbers as far as what's been assessed. I think they're still in that process for kids to be assessed and make sure they meet that level of care. So I don't know exactly what that'll look like volume wise for Franklin County, but we feel like for that age range, there'll be a good capacity.
Yeah.
The school has paid a lot of attention to that. Another resource that we've put in place in Franklin County and has been in place since March is an acute transitional care manager over at Mariah Parham Franklin. Mariah Parham Franklin, as I'm sure all of you know, stays inundated with behavioral health care needs. Very difficult to manage, not another place for them to go right now. Not a diversion opportunity. Lots of high volume, lots of complexity coming through that hospital, where some more, appropriate would be a state psychiatric facility. So we recognize that. We work very closely with them and our local law enforcement to make sure that we can allocate whatever resources we can to come in and basically help alleviate some of that need. We know that we still don't have a facility. So we've placed in a acute transitional care manager that works directly with those staff at Mariah Parham Franklin. She's a VIA staff, and she assists with those assessments and referrals to ease some of that load. And that was just a decision that we came to because of the need and feedback from the community, from our community partners. The next development that is still under development, but is coming, we've got the unit, we just need a place to park it, and we think that there's going to be a good place in Lewisburg at our FQHC Advanced Health. And that's our mobile opioid treatment program. So right now, for folks with primary opioid use disorder, if they need medication management that includes things like methadone, if that's where they are in their recovery, they have to go to outside counties to receive that service, to receive that medication. There is a service, a program in Zebulon, but for folks that are on the eastern or western side of the county, they have to go to Henderson or south to Wake or Durham to receive that medication, and some of them need it every day. It's not just about the medication. This is a treatment program, right? This is not just a place to go and get a particular medication. But these are therapists that offer outpatient therapy and coordination for other treatment services for folks that need it so that they can be successful in their recovery. So that's coming. That came from a grant from the state and will be contracted directly with VIA to operate that. All right, here's the other biggie. So this is our Regional Crisis and Diversion Center. We have received a grant from the state of North Carolina for $7.1 million. That's not going to cover the entire cost, but it's going to cover the lion's share of it. We also have contributions, not just through the maintenance of effort funding that already is in place from all of the three counties, Franklin, Granville, and Vance, but our own funds, the operating provider, RHA's funding, are going to cover the cost to lift this facility up. The facility itself will not be located in Franklin County. It'll be located in Henderson, right behind the hospital in Henderson, but it will very much serve Franklin County. We're going to have agreements with all of our neighboring first responders, our hospital system in Granville makes it easy when it's Mariah Parham that operates both, to make sure that folks that come that really need to go to this facility get there successfully. We're spending a good deal of creative energy to make sure that that happens. So right now, we're still in the contracting phase. We have the design plan finished. It's a 22,000 square foot facility. We know exactly where it will go. We've got all the permits. We just need the contract and the lawyers to agree on some of those red line items and get us over the path so we can knock down the building and get going. Right now, we've estimated sometime in September, we will do a groundbreaking for that facility, and I hope all of y'all are able to be there. So that facility will operate, as I've mentioned, a diversion center. So place for people to go versus the emergency room when they have a mental health crisis. It will also operate a behavioral health urgent care. The facility-based crisis portion is 24 hours a day, and it averages about a 7-day length of stay. So it will be those crisis facility components, but it will also serve as an outpatient clinic as well, and an on-site pharmacy. All right, I know I've been talking for quite a bit, and Meredith's probably ready to get up here. But I did want to give a shout out, and this is certainly not an exhaustive list. There's only 4 entities on here, but we've just, we don't do any of this work alone. We're part of a village, and we just so much depend on our partners in the county to do this work with us. I'll give a definite shout out to the Franklin County SMART team. Their team has been fantastic. Meredith and I keep in very close touch about the needs in the county. I feel like that's a great investment. They've been a great partner of ours, and they're out, they're boots on the ground. They're seeing these folks, they're following up, they're making sure that people get connected with care. Obviously the hospital, our Department of Social Services, we quite literally could not do this without them. They of course manage the enrollment and pass the torch, if you will, to make sure we're doing what we need to do. And then I just wanted to highlight our partnership with the school system as we lift this new program, Vine Academy, in the county. Love it if you have questions for me.
Does anyone have any questions?
I'm curious on the new crisis and diversion center that you have. What does comprehensive walk-in center mean?
Sure. That just means you can walk in without an appointment.
Gotcha. I made that way too complicated.
No, all right. Well, they also will have some physical health capabilities there. So if somebody comes in and they need medical clearance or need something checked, there will be nurses on staff.
Yeah.
There's security. But yeah, just the nature of a comprehensive walk-in center means that you can walk in without an appointment.
Gotcha.
And it also means that they can serve you not just with basic outpatient therapy, but if you need a community-based service, somebody to come to your home, they've got that capability as well.
I just want to say that I did know about the Vine, the facility being used for this. And I'm excited about that, 'cause it's right there in the middle of town, right behind the school. That's a great building.
Yeah.
Right there on the school. It's not a very old building. So it's a great building, great location. And I hope you can think about expanding services to the middle school,
Okay.
especially to the kids in middle school. Because they're right there in front of you, and then there's another, there's middle schools all over the county.
Yep. They can literally walk right across the street when they're ready.
Those kids they can walk right across the street, and I hope that they will if they need that, So I'm happy to hear that. I'm also on the Mariah Parham Hospital Board, so I've been hearing about your facility behind the hospital for a long time now.
Right.
So I'm excited about that too, the new facility there.
Thank you for mentioning that. Yeah, the need is great with that
Yes.
hospital. They need another option. They can't handle the volume.
Right.
So.
Right.
Yeah, and I've talked with the school system. They're already, the idea of expanding is already in their radar, and they've already identified that there's adequate space in there to handle it. when
Right.
it's time.
Right. Is there any other questions? All right. Thank you so much for your report tonight.
Thank you.
Our next to be item B, substance abuse and mental health advocacy response team update. And we're looking for Meredith Wester to come up and talk to us about it.
Good evening. I am Meredith Wester. I am the Director of Programs for the Franklin County Sheriff's Office, but I was also hired by Franklin County to manage the opioid settlement funding that came to the county several years ago. So this presentation tonight will serve as the yearly required update from the state, but also from the Department of Justice that requires this to be done every 12 months. Everything in this presentation that I will present will be an explanation of where the funding is being sent and how your funding is being spent based off of the criteria and the qualifications and all of that good stuff for the amount of money that Franklin County will receive and has received for the next 18 years. All right, so going back to the very beginning, just to recap for those that may be new, in 2023, the end of 2022, first of 2023, Franklin County received the first set of money that came down from the federal government. The money specifically requires that it be spent on substance use, mental health, opioid use disorders, and there is also a distinct direction for it to be spent on people that are justice involved, meaning people that are in and out of jail systems and people that have interaction with law enforcement. So in 2024, the county and myself got together with Sheriff Kevin White and created what is now called the SMART team, which is what a lot of you hear, SMART, which stands for Substance Use Mental Health Advocacy Response Team. The function, let's see, I'm sorry, I don't know why it's not coming up. Okay. So it was established to provide quality law enforcement, public health, and safety services to our community. It connects people to services for mental health, substance use, and other social needs. But it also aims to reduce the amount of repeat 911 calls and racial and jail recidivism by connecting people to the services that they need. A lot of what the county was seeing was that we didn't have any way to track. We didn't know how many calls were coming out. we couldn't keep up with a lot of that. So one thing that the SMART team does is try to connect all of those individuals with those sorts of services. Our responsibilities are to respond and follow up on referrals, identify at-risk populations, develop and maintain professional relationships, develop and maintain training programs, identify and reach out to high utilizers of 911 services. High utilizers meaning you may have 80 to 100 calls coming through 911 by the same person from the same address in a very short amount of time. So how do we do this? How do we connect the data? How do we look to see what we're doing and how we're doing it? We started reaching out to our community partners, and I'll talk about that in the next few slides with, let's see, it's not coming up again. I don't think this likes me. You might as well just sit right there.
I was gonna make a joke, but this is our SMART team here.
Okay, so when you look at your call data, I analyzed the call data, the amount of the call data from pulling together several reports. And you'll see on there where it says RMS, patrol, and then the student resource officer notes. So I started trying to gather what was coming through on the 3 different systems that in between 911 emergency management and law enforcement use. And then I created weekly, monthly, and annual reports to try to track those types of calls that were coming in, whether it be on scene, coming through the magistrate's office with IVCs, and those sorts of activities. And then from there, SMART would look at how we were going to follow up. We could respond while we were on scene, but we could also go and respond later on that day, the next day, or whatnot, once the report came out and we could see what was going on. All right, so these are the numbers. Everybody wants to see data, kind of what things are looking like. So if you look at 2025, the total calls for service that came in through your 911 system that were just through the sheriff's office, this is not including your PDs, this is only for the sheriff's office, were 26,268. From there, I broke it down to your mental subjects, overdose deaths, threatening suicides, attempted suicides, suicide deaths, welfare checks, and IVCs. This is the particular category that the opioid funding targets. And these would be the only types of service calls that the SMART team would respond to and or follow up on. So if there's another type of call that you're looking for, and it's not in here, that's why, because that's not something that we cover. In 2026, the cutoff date for this was the end of June of this year. So on the last day of June of this year, there were 14,035 calls with 91 mental subjects, 23 overdoses, 43 threatening suicides, 401 welfare checks, and so far 189 IVCs.
Okay.
Yes.
What does IVC, the bottom one, mean?
Involuntary commitment. So the involuntary commitment is a lot of what Elliot is talking about with your behavioral health when people are going into the emergency room because they have nowhere to go. A lot of the times they're either coming to jail or they're going to go to the emergency room under an involuntary commitment order to try to go get help somewhere to a facility.
Thank
Yes, sir. Okay, the other part of the funding that is used that is not on the patrol side for your justice-involved individuals are going to be under our Stepping Up program. And as most of you know, Franklin County has been involved on a regional level with Stepping Up since November of 2016. So since November of 2016, we have been involved in this program called Stepping Up that specifically targets your jail-based population. And so once the funding came in for the opioid funding, then we were allowed to kind of grow off of what we were currently doing and already doing in the jail and then move on to services that we were unable to provide due to funding because there was a lack of funding or we didn't have it. But once we received the opioid funding, we were able to now provide those services. If you look, that will include your clinical assessments and your therapies by Dr. Coy from Correctional Behavioral Health. Then it will go down to an actual comprehensive clinical assessment from Vision. We have a therapist that comes in, also along with myself, to assess people that come into the jail for mental health and substance use disorders. And then we have other recovery and reentry support and education that is provided. We also have used the opioid funding to hire an additional social worker that comes into our jail to help our team look at discharge planning, what services they need upon discharge, whether it be mental health, substance use, housing, transportation, medication management, all the above. Under the reentry and support and education, and this is getting ready to come up as well on the next slide, but you'll see where it says tablets, GED, and veterans. So I began to see an uptick in the past couple of years from the veterans that we were seeing coming into our jail. So I was able to also connect with the veteran, the VA facility in Durham and the new facility in Garner, so that now when a veteran comes in and we assess them or we see them, I can directly reach out to the VA to let them know that we have a service member here to see what we can do, because a lot of the times they can provide more than what we can at our level. The GED, quite a bit of people, as you'll see in a minute, that do not have a GED and are on, even on a second and third grade reading level. So we use some funding to increase services on our tablets so that while they're in jail, currently waiting on their court date, they can look and start taking GED classes to better themselves to hopefully reduce the recidivism. Classes can be free. However, the testing for the GED is not. And so that is another thing that our opioid funding is used for. All right, so estimates of detainees with mental health substance use disorders. Now, if you look at 2025, I used 2025 so that I could give you just a 12-month time frame. I always like to go back 12 to 24 months because typically when you start a program, you need that long to be able to look at sustainability and, you know, how the program is going to run and if it's going to succeed. The total new admits under 2025 were 2,382. Roughly half of those disclosed mental health, 75% disclosed substance use disorders, so on and so forth. And then I broke it down to total confinements, how many were returning detainees, how many were released, and then the offender type that came in under that, male and female. So that just kind of gives you an idea with the capacity that our Franklin County Jail can hold, and then what we can do based off of that number with the current services that we have. All right. Currently in the detention center for mental health and substance use services, in 2025, there were reported 415 that had mental health issues, meaning that they self-reported in booking. So what I always tell people is, take that for what it says. It's a self-report. That we have not assessed them yet. We have not done anything to clinically give them a diagnosis. It's just they come in and I say a general question, do you have any current, past, or present mental health disorders? And it's a yes or no. In 2026, this year from January to June, already we have 240 that have self-disclosed that. Underneath it is substance use issues. Far more, with 1,121 last year, and then this year so far, 471. The services that are provided, the new referrals, so Vision Behavioral Health, as you heard Elliot Clark speak on a little bit, that is the provider that comes into our jail that currently has the contract to help us with our behavioral health, mental health, substance use types of inmates. And so they come in and do a lot of our assessments. We have another company, Dr. Coy, with Correctional Behavioral Health, that does our suicide watches and also does some of our more psychiatric treatment with prescription and medication follow-up and recommendations. Those numbers for 2025 for Vision were 17, and then in 2026, so far it's 15. We just have started the peer support and case management piece by bringing in an additional staff, but already, as you see this year, we're up to 43. Peer support and case management went from 33 in 2025 to 65 already this year towards the end of June. I think you'll see the biggest numbers with the severe and persistent mental illness, which is your SPMI, your clinical assessment services. Those are the folks that we see the most of. That can be a co-occurring disorder, meaning they have both mental health and substance use issues and require more extensive mental health treatment, whether it be psychiatric medications, whether it be that we need to send them to Central Regional, whether it mean we send them to safekeeping because they're so complex that we can't handle them while they're waiting for their date in court. It just depends. But that's going to be your highest one. Any questions so far?
Can you speak a little bit about since I think you just said it was new, and I'm trying to follow along as best I can, but the peer support and case management, the follow-up aspect of that, you obviously added additional
Component.
help there. What does that follow-up look like?
So let's say that I was brought into jail, and I'm brought into jail, and I'm in booking, and I get assessed, and then I get booked in, and I'm there until court. But I disclose that I have some type of disorder, mental health, substance use. We do see within that issues of domestic violence. We're starting to see an uptick in sexual abuse, child sexual abuse. We also see issues with, whatever it may be, intellectual disabilities.
Sure.
So once they come in and that is determined, then we have set days that our therapist and our other team come into the jail. It works around the court days, but it's a separate day. So they come in and I have a list for them. They come in, they see all of those inmates that we have flagged for mental health and substance use. Based off of their charges, this program would not necessarily apply to your violent offenders because they're going to be the ones that are going to serve time in prison. I can't help them if you're going to prison, but I can help you if you're going to possibly get probation or a lighter sentence, maybe a first offense, whatnot. So we start planning for their discharge date. And so we go over there and we go over everything. Are you currently in treatment? Are you currently on medications? Can you afford those medications? If you don't, why not? What do you need? Do you have housing? Do you have transportation? Everything and all the above.
You're helping them structure a plan
Correct.
together.
We're doing that structure plan. And then from there, I will go when necessary and meet with the district attorney's office. And I lay out the plan for what we have recommended on the clinical level for whatever it is. If it's drunk driving, for example, DWI, if it's their first offense, okay, you made a mistake. I get it. You shouldn't have gotten behind the wheel. They're not going to give you a hard time, maybe. But if you take a plea deal, maybe your plea deal is you go to 6 months at Dark Cherry, go through a program so that you can get rid of that or whatnot.
Yep.
And go from there.
Gotcha.
Yeah. Any other questions? Okay. All right. So I went back and looked at our 2025 accomplishments just because in the presentation last year we did discuss what some of the current goals were. So on this side were the operational component was first. How are we going to put SMART together? How are we going to develop it? The processes, the procedures, we accomplished that. The next thing was looking at a law enforcement assisted lead program to enhance the diversion. We've identified options with that, whether it be hopefully with this facility that's now coming in Henderson so that we can divert there and divert to walk-ins versus to the local emergency room. Those numbers are still being looked at from my end. And then we wanted to pilot a GED program in partnership with Vance Granville because of the amount of folks that I saw coming into our jail that did not have a GED, which led me to the second piece, which will be for 2026, looking at a literacy program. It's one thing to not have a GED, but it's another that you can't even read the GED words to get your GED. So we started looking at what types of reading classes Vance Granville May would offer so that when the instructor comes into our facility, we can offer time apart, one for the GED and one for the literacy program, 2 separate opportunities. Oh, let's see. Okay. All right. The risk need assessment analysis. So we get reports weekly, monthly, and quarterly based off of what our inmates are filling out and the types of programs that we have. And so one thing that we looked at, and these are going to be more of your numbers, is 34% report that they do not have a high school diploma or a GED. 25% of those report that they're having literacy challenges. And then on down becomes your addiction and mental health. 60% report that they are addicted to alcohol and or drugs. 61% report that they want treatment. And then 44% want help with their mental health. And so I try to use this risk analysis to guide myself in our goals for the next year so that I know what is realistic and what is feasible based off of not only our budget, but also what the needs are in the community and what partners I need to pull in. Any questions?
Is there a big disparity between the male and the female with wanting help with the mental health as far as percentage goes? No.
No. I would say that if there are children involved, you're going to get, for the females that have children versus females that don't have children, the females with children are going to ask for help first because of the kids. With males, I really don't see any difference. All right. I think we went backwards. Okay. So we piloted the peer support program. I believe we started in October of 25 on that. I don't remember the exact date of the month, but it was October 25. And so far, that program has been very successful. And we have been able to continue with supporting that through the opioid funding and then seeing some success rate with that for people who are continuing to follow up when they get out of jail. And then, of course, we're continuing to build the relationships across our continuum of care to respond to the ongoing needs across. Because this is a distinct population, not everybody is going to need to be involved in the very beginning or even throughout the process. Because we're dealing with the judicial system, we're dealing with HIPAA, with diagnoses, most of this population centers around the same 4 or 5 different agencies. And so if you hear me talk about the same agencies, it's because most of our people that we case manage are all involved in the same little bubble, if that makes sense. I also continue to look at and to improve data collection systems. And I bring this up again, and it's going to stay on my goal for 2026. A lot of our systems do not talk and they do not intertwine. So, for example, when you saw the IVCs, we may have 500 IVCs, for example, but I don't know if that's 500 individual IVCs or if that's 200 people that were IVC'd last year alone multiple times, which I can tell you that's people that have been IVC'd multiple times. But to be able to do that and to look at that, that does not automatically talk to us on our side for me to be able to look at. I would physically have to print all that out, sit down and go through all of those 500 and just kind of group them together. So I would like to see a system that is a little bit more user-friendly with things. Okay, regional stepping up priorities. So just as a reminder for some folks, we are in a region with Granville, Franklin, Vance, Halifax, and Warren counties. This county is in an agreement with all of those counties. So you basically sign that agreement and that forms your region for the stepping up region. We are the only region in the state of North Carolina that has a regional stepping up. The other counties in the state do this independently. For those of you that may not be familiar, we did that, or you all decided to do that back in 2016 because none of our 5 counties were financially independent enough to be able to support all of this on their own out of a general fund, for example. So every county puts a piece of money into a pot pretty much that is managed by one of our 5 counties. And then regionally we decide, or everyone decides what they're going to work on for that fiscal year. So I put this up there for the regional stepping up priority so that you all could take a look at that and know that from a regional standpoint, this is what was decided on. Any questions on that? Okay. All right. Now here are Franklin County's priorities for 2026. We will continue to develop and refine the SMART Team program, streamlining collaboration processes, monitor the employment-related criminal justice program in partnership with Vance Granville. I want to look at that specifically because it's one thing for our folks to complete the GED program, but it's another for them to also be able to take the test to obtain the certificate. So the test is free, the curriculum is free, the test is not. But if you don't take the test and get that actual certificate, it doesn't do you any good. You can complete it all day in our jail, but if you don't have the whole thing, it's not going to do you any good.
How much is the test?
Yeah.
$75. So out of the opioid funding for people that have mental health and substance use disorders, we have set aside a certain pot of money for those individuals. So when I get that report that says, hey, they have finished the GED program in our facility, they know they can take the test. We have the agreement with Vance Granville that they send that to our facility and we will pay for that test.
About how many do you think or believe complete the GED?
From 2024 to the end of June of this year, we had 50 that graduated with their GED. Now, out of that, not all of those 50 got the certificate because they either bonded out and never came back. So I wasn't able to track those. That's kind of the skew there is we're not obviously like a state facility where they've been sentenced to prison and they're there for 12 months. So I have 12 months to do this. Sometimes my hope is that they will be there long enough so that they can finish it, but I probably shouldn't say that out loud, but I want them to be there so that I know if they finish it, they get that GED and then they have a chance to get a legal paying job when they finish.
How quickly
But
can you get the GED? How quickly could you do it?
it depends on how long it takes them. If they're doing it on the tablet, it just depends on how long it takes them to complete their task on the tablet.
That's a hard question. to
Yeah, I
ask.
mean, it's not going to be one or the other. Now, if you're sitting back in general population and you're going to be there 6 months or 6 weeks, you do it every day, you can finish. It also depends on your reading level. So if we have a mental health detention officer who handles all of the stuff for me in our clinics. If she identifies that you are having trouble reading that, then we try our best to kind of pull out some if it's safe, and we'll help kind of guide that. Or I'll say, look, let's not do this on the tablet. Let's wait until the instructor comes in when we're in there and we can teach you and then go from there. So it's really not a, I'm sorry, I can't say, 3
No, I guess it was a tough question. It wasn't a fair question to ask you. It was more of like, is it possible that you could do it in a month is it 2 weeks? Is it, no matter what, it's going to take you 12 weeks to get through it. That's kind of where I was.
Yeah, no, it shouldn't
get
take
it out.
12 weeks.
Okay.
It should not. It just, they don't have anything else to do.
Yeah.
So, I mean, they can sit there and work on the tablet and work on your GED. But, so yeah, it varies.
Can you use the opioid money for some of this GED?
As long as it is specifically related and they have mental health and substance use diagnoses. And so that is the way that it is approved. And I hate that sounds bad because if I have someone else who doesn't have that doesn't have a GED, but they don't have a diagnosis, then, I'm put in a spot to say, well, I'm paying for you, but I'm not paying for you. So I also have looked at for the next fiscal year, maybe in, the regular budget, if that's what you call it, separate and apart from our special revenue fund, we could put out a few $1,000s so that when I do have those people that come, I can say, yes, I can provide that for you. But that would come out of most likely the sheriff's office budget, not my budget for the opiate funding. So just FYI for next year.
So, do I hear you saying that some people complete the coursework and then they leave before they get the certificate? Can they come back and get the certificate?
I have offered that to them, yes, ma'am. Now, whether or not they do,
That's
I
up
have
to
not
them.
had,
Okay.
but it is
Okay.
offered to them.
That's fair.
It is offered to them. And I have even told the Vance Granville instructor, hey, let's say you're in your office one day and this person shows up and says, hey, I was at the Franklin County Jail and I did this, but I never took my test. I said, call us. That way we can look up, make sure, in fact, we can verify, and then we can work something out.
Okay.
I don't want to set people up for failure. I want to set them up for success. So I believe that if I can extend that, then hopefully we can do it.
Okay.
It's just like Narcan, for example. If they don't leave with Narcan, but they need it, I have told some people, come to the front of the sheriff's office. I'll give you Narcan. I'm not going to arrest you. I'm just going to give you some Narcan to help you. And they look at me like I have 3 heads because I'm telling them to come back to law enforcement to get that. Same concept for me.
Got it. Okay.
All right, let's see what else. Okay, community-based collaborations. So I'll start with Franklin County agencies first. Like Elliott and VIA, these are your top county agencies that the opioid funding could not function without their collaboration. The Department of Social Services, a lot of our people that we interact with through 911 and even the jail, especially the Adult Protective Services unit at Social Services, we have shared a lot of cases back and forth with investigative purposes. EMS, the best program they have, in my opinion, is your community paramedic program. They're responding to them in the community. They're seeing what's going on. They need to be followed up. So Virginia Campbell and our team meet weekly so that we can staff these cases so that we know who needs to be followed up on and what they need, and they don't fall through the cracks because they don't get a service from one or the other. The health department has been very beneficial as well with their primary care clinic. They now have a licensed clinical social worker on staff at the health department. So she has started to come to our meetings, so that if we have people in our jail that don't have a primary care physician, when they leave, they can go to the health department and be seen. 911 communications, specifically Brian Smith, helps me a lot with my reports to pull this stuff, and it is not easy because there again, the systems do not talk. And so he is on board with helping with my weekly, monthly, and quarterly things. And of course, the finance department, right? Because this is a special revenue fund. This is not what I call just, an easy thing to be able to manage. It's a lot of money. And so your finance department helps me as well, try to keep everything in line. Our external community partners, of course, VIA. I also have Trillium there because we pull in quite a bit of people in our jail from other counties. So Nash County and Halifax County are on your Trillium side. And then, of course, if I see you and you're from Youngsville and that area up towards Wake County, that's going to be the other MCOs. So I try to have connections with all of these since we do pull in people because we have number 1, 401, 39, and all of that. Granville Vance Public Health out of Henderson, because there again, we pull a lot of people from the Epson area. UNC School of Government, I utilize quite a bit just for policy and things like that. Our local PDs, we partner with our PDs a lot as well because they arrest people, they bring people into our jail. So we need to have relationships with these officers on the street so that we can let them and invite them to participate in our trainings, talk to them on a daily basis so that they're in the know as to who's in their community and what's going on with them. Vision Behavioral Health, we also utilize Innovative Behavioral Health out of Youngsville. There again, if we have people on that side of the county due to transportation and insurance restrictions, I try to pull from different areas of the county so that, our folks don't have to go so far. And then, of course, Correctional Behavioral Health, who does a lot of our suicide assessments and things like that in the jail. And I'm sure I'm leaving out somebody, but the screen wasn't big enough. So any questions? Our big yearly report will be coming up. Will be due the end of September. So Finance and I will be buried trying to get that done to ensure that, programmatically and financially we're where we need to be. And so far, thankfully, we have been. Yes.
I just like to make one comment. Sounds like you're very well versed and on top of things in your department. It really stands. You're not just locking people up, but you're actually trying to reach out and help them and get them straightened out.
Well, that's what the money's
I
for.
applaud you for that one.
Yeah. I mean, that's what it's for.
I have one question. I'm sorry. Go ahead.
That's all right.
Finish up.
Keep up good work.
Thank you.
Yes, ma'am.
The recidivism rates when you start since the inception of this program, have you been able to track? Have you seen them decrease? Have you been able to tie those, tie what you guys are doing specifically to?
Sure. So let me think. Let me go back. 2023, 2024. By the end of 2024, I was fully staffed up and running with the SMART team, which consists of myself, a full-time social worker, a full-time data person, admin, and then a full-time deputy that is assigned to SMART specifically to answer mental health and substance use calls. So we sent her to all the training, CIT, and all of that. So this is 2026. So probably for about a year and a half, we have started.
Yeah.
And what I will say in my experience is that it's going to take, I'd say 12 to 36 months because a lot of these people it's not like you work with them one time and then they're gone, right? Yeah. These are the types of people just based off of diagnoses or problems and issues that they have. They're like your kids. You want to raise them and then they fly, right? And they go home. But sometimes these people don't leave home. They come back and they come back to us and that's fine. So our recidivism and our success rate look a little bit different.
Right.
Especially someone with a mental health disorder or a substance use disorder. If they stay clean for 3 months, that's success. Mm-hmm. But then if they relapse, okay, that's fine. They come back to us again. Mm-hmm. So I would count that as a success, but then also they did, with the recidivism,
the
they
data
did come
wouldn't
back.
show it, but what
Correct.
real world is.
What real world is.
Yeah.
Yes, absolutely.
Does anyone else have any other questions? If
If you
not,
do, you know where to find me. So.
thank you for
Thank
your
you.
report.
Yes.
Very good report. Thank you. Item number 4 is appointments. And for our item that's under here, I'm going to call on Commissioner Davis to present this.
Thank you, Chairwoman. I'm going to go ahead and read this and get through it. But number 4 is appointments, Firemen's Relief Fund Board of Trustees, Youngsville Fire Department. The board is asked to consider appointing Andrew Dudash and Harold Bud Holden to the Firemen's Relief Fund Board of Trustees for Youngsville Fire District pursuant to NCGS 58-84-30. Each county deriving benefits from the provisions of this article shall appoint a local board of trustees known as the trustees of the local firefighters relief fund, be composed of 5 members, two of whom shall be elected by the members of the local fire department who are qualified as beneficiaries of such fund, 2 of whom shall be elected by the mayor and board of aldermen or other local governing bodies, and 1 of whom shall be named by the state fire marshal. Appointments made by the local governing body shall be residents of the fire districts and serve at the pleasure of the governing body. There is no term limit for relief board members. And I will pass this over here in just a minute, but action request would be consider appointing Andrew Dudash and Harold Bud Holden to the Youngsville Fire District's Fireman Relief Fund Board of Trustees.
And you make that in form of a motion.
And I do make that in form of a motion.
Second, Madam Chair.
We have a motion and a second. For everyone who approves, say aye.
Aye.
Anyone that disapproves, say no. Okay. Ayes carried, motion carries.
Thank you, Chairwoman.
Thank you. Our next item is our board and manager and clerk's comments. And I'm going to start with our attorney tonight. And Ms. Clark, no comment. Commissioner Floyd.
Yes, I'd like to start off, I know I missed the last meeting. I apologize for that. Do I ever? Thanks to a doctor's appointment that was supposed to be at 3:30, 4 o'clock. And you know how that went. I waited and waited, but I can say one thing, that won't happen no more. No more do I do an appointment on the day of a meeting. But anyway, I'm going to go back over some of my report from, if I had been here last time, some events that I went to. I know on June 6th at Walmart, Scott Strickland and his CERT team were out there doing their fundraising event, chicken plates and everything, just going to town at it. I applaud them for their efforts and their determination to make their CERT team work. Kudos to them. June 16th, we had Martha Mobley and the Cooperative Extension Agency doing the first ever beef tour event. Very first one. I hope she does very many of them. Just like her upcoming event that's coming up this Friday with the horse farm tour. She's been doing that for 30 years. So I applaud and send my thanks to Martha Mobley and her staff there at Cooperative Extension for making all this happen. June 18th, I went to an event for the veterans of the county here, there at this building right here. It was very successful, put on by Miss Wilkins and Miss Yarborough, the veterans staff. And we fed everybody real good with hot dogs and drinks too. Anyway, it went real good, part of that. And something very recent, I helped with and attended a fundraiser for a person from Maryland, Keith, Amara Jackson, that is suffering for cancer. She's a very young lady, and they were doing a fundraiser this last Friday, South Main Street Baptist Church, which I attended. It was very well attended. They were really out there hustling, raising funds, and I applaud them for their efforts to do that, to help the young lady with the cancer. And that's all my report for the night.
Thank you, Commissioner Floyd.
Yes, ma'am.
Commissioner Davis, do you have anything?
I want to address something, and Miss Galusha has walked out. I was hoping that she was going to stay. What I was going to tell her was that can't speak for the entirety of the board, but I have read her emails. I'm a little confused to be honest with you, sitting here. This is the first time tonight that I can think of that there's a concern now on the flight patterns at the airport. I believe, if I remember correctly, and maybe Ryan can correct me if I'm missing something, this started out about water quality regarding the airport runway extension. And it was focused primarily around the extension or future extension. And then as this thing has progressed, it's progressed into a little bit more of the current county operations or the current airport operations. And so I don't know. I just wanted to I wanted to address that first of all. Obviously, we're waiting on some things completely outside of our control with the extension, and however that's going to go down. And I certainly hear her concerns about water quality and noise abatement and all that stuff. I do not want to disregard it. But I also am not sure exactly where flight patterns have come in all of a sudden. And so, Ryan, if I'm not mistaken, you've also met with her on the phone. Excuse me. So you had a phone meeting with her for quite some time back, probably in the spring. Am I right?
It was only water quality. Yeah.
It was only water quality. So I understand that people don't trust local government. I get it, and people get frustrated. I didn't particularly like that because now we're talking about some things that, to be honest with you, I've never seen. To be honest with you, mentioned. So maybe it's time that if we circle back up with her one more time, and I probably would like to find out exactly where flight patterns have come into this as well, just so that this board is fully transparent. But I don't believe that's anything that we have missed, and I wanted to get that on record. So other than that, that's all I had.
Commissioner Schreiber, your turn.
Thank you. I also, like Commissioner Davis, I was a little curious about a few of her comments. I know that she got an email that she didn't evidently particularly care for, but it's a reality of when these requests come in that are just an enormous amount of data collected in various different places, and the time it takes to put those things together by whoever it is that pulls that data. I don't think it was fair for her to say that that was the only response she got, because I personally have spoken with her, and I personally emailed her and guided her towards the state, because the state is who is doing this, not Franklin County. It's not this board that has an idea and a plan that we're going to extend this runway. This is the state trying to look into the future of what they see going on and where they feel the needs of North Carolina generally need to be in a region when it comes to air traffic. And so I didn't think that was very fair to just leave the impression that we as this board, or me individually, or Commissioner Davis or anyone else, or the county staff has not responded to her, because I know personally that that's not true. I happened to Google, for what Google is truthful to, does recreational aircraft, which is a large majority of the aircraft that come and go from our airport, does that pollute well water? And the answer was absolutely no. It says no, normal recreation aircraft in flight do not create well water contamination. So I'm concerned about, or curious I should say, on where her concern really comes from. I kind of wish she'd stayed around tonight, but maybe we could get the opportunity to speak just a little bit more. But I can't help somebody if I don't understand. If you can't take me to the barrel that holds the problem and tell me here it is, and then I can see it and appreciate it. So certainly willing to do that, and we certainly can have another conversation with her. But really, I believe the answers to her questions are with our State Department of Environmental Quality and those people. That these are the professionals, and these are the ones that this is what they do and what they understand, and they have the data and the resources and the tools and the testing and all that. Franklin County doesn't. That's not what we're chartered to do. So I hope that she would spend her time maybe seeking her information out more at the state level or the regional DOT aviation people to get that. So, but anyway, so yes, hopefully it's been a great summer for everybody. I know it's been unseasonably wet in July. I don't think I've heard anyone complain about that yet. I did mention to Commissioner May about the back end. It's just, yeah, it's got too much rain now. So, but that's Mother Nature's humor, I guess, keep us on our toes. So that's really all I had at the time. Thank you.
Okay, thank you. And Commissioner May, your turn.
Went by the Franklin EMS station again, the senior citizen, and one day them seniors are gonna be real happy with what they got there. Moving up from where they at now, they're gonna be like going from almost hell to heaven, you know? So, congratulations to them.
Yep. Okay, Commissioner Speed
No comment.
and Commissioner Bunt.
I have no comment.
Okay. It has been a vacation month in July, so I haven't been as active as I normally am. I did attend the Franklinton Dentist office. It's called Franklinton Family Dentist. That's opening real soon in Franklinton. It was well attended, tons of people there. They have, y'all have got to go into the inside of that office. It's all brand new. It looks wonderful. If you need a dentist, you may want to come to Franklinton. It's located at the Food Line Shopping Center. There used to be doctor's offices down there. Actually, the hospice office is on the left of that building. On the right of that building is his dentist office. In the middle, they still have some space that can be rented, and they would love to put a PA in it one day, or a doctor or family practice there in that spot one day. So I did attend that, and then I attended the opening of the new Bailey's boutique. It's a women's boutique in Franklinton, and they just had the opening. They haven't had the ribbon cut. It's going to be next week, but let me tell you, that place was so packed. It was so packed when they opened the doors. So that's pretty much what I did this month, other than go on vacation. So, okay, our county manager.
Thank you. I just want to speak to the comments by Commissioner Davis and others. We will speak to Ms. Galusha, if need be, engage our engineer at record, make sure we cover that. And if need be, we'll direct her to the Department of Education.
Okay.
But we will follow up on that.
Thank you.
That's it.
Is that it? Okay. Okay, we'll go to item number 6, which is closed session. The board is asked to enter into closed session in pursuit to the following North Carolina general statutes. NCGS 143-318.11A3 attorney-client privilege communication. NCGS 143-318.11A4 industry economic development. NCGS 143-318.11A6 personnel. Do I hear a motion that we go into into closed session at this time?
So moved.
Second.
Did we have a second? And all approve, say aye. Everyone that disapproves, say no.
No.
Okay, that's carried.